What did Islamic scholars contribute to medicine and mental health? Imagine a time when science and faith worked hand in hand to heal people. Islamic scholars played a key role in shaping medicine and mental health care during the medieval Islamic period. They didn't just copy old ideas, they built on them with careful observation and experiments. They translated important texts from Greek, Persian, and Indian sources, making sure knowledge was preserved and expanded. Scholars like Ibn Sina, also known as Avicenna, wrote a famous book called the Canon of Medicine. It became a standard textbook in both the Islamic world and Europe for hundreds of years. Another scholar, Al-Razi or Rhazes, focused on clinical observation. He was among the first to tell the difference between diseases like measles and smallpox. Islamic hospitals, called Bimaristans, were ahead of their time. They were funded by charitable donations and provided free care to everyone, including those with mental health issues. These hospitals had separate wards for different illnesses and even medical schools to train new doctors. They created systems to license physicians, making medical practice more professional and trustworthy. When it came to mental health, scholars saw it as part of overall health. They believed mental illnesses were medical conditions that needed treatment, not just spiritual problems. Treatments included medicine, counseling, and spiritual care like prayer and ethical advice. This approach showed how body, mind, and soul are all connected in Islam's view of health. The teachings of Prophet Muhammad encouraged Muslims to care for both physical and mental well-being. He said Allah has cures for every disease, inspiring doctors to find remedies and reduce suffering. Today, this history reminds Muslim families and communities that seeking professional help for health issues is part of caring for oneself and fulfilling religious duties. Using medicine and therapy is seen as a way to preserve health and strengthen faith. This balance of science and spirituality supports healthy parenting, modest living, and personal growth while keeping a strong Muslim identity. In short, Islamic scholars made lasting contributions by saving and expanding medical knowledge, creating hospitals and training systems, and promoting compassionate care that includes mental health. Their work shows that caring for the body and mind is a form of worship and responsibility in Islam. This legacy encourages us today to seek professional help when needed, knowing it aligns with our faith and values for overall well-being.